All right, we're all here to do an experiment today. That's what we're going to do here. Welcome, everybody. Is it 11 o'clock?
It is.
It's 11 o'clock. All right. Okay. So let's just start out and let you know that we've had a few technical difficulties, but we do have Matt. I can see Matt, and I can wave at Matt. But Matt can't see me. But we can hear each other because that's why I've got this in my ear today. So we're going to talk through my phone, but we're going to talk to you, the audience. We're going to cover off all the same awesome information that we were going to share with you when we put this up to the market. So welcome, everybody. It's Deb Wiegers, and this is our 5th edition of Thursday Live. We've got Matt Brady in the house, and we're going to formally introduce him later. And say hello, Matt.
Hey, everybody.
See, he's here. He's in another house. And we're going to introduce him, and we're going to talk about virtual healthcare today. So it's obviously been top of mind for many years, really years, but now it's escalated to a whole new level, just more because of COVID. And so we're going to talk about what that means, where it was, what it is, and where it's going. So we're going to do that. A couple of things while we're getting people tuned in. I want to do another reminder that for us at Wiegers Financial and Benefits, we have our gathering. I see the front foyer. We've got people dropping off, our employees that are working remote. We've got employees dropping off all sorts of things for EGADS, Lighthouse, and we're going to do a drop-off. So for those out there, if there's a charity that you want to support, I highly encourage you, because it will feel good, and we need a lot of feel good today. It would feel good to put some things together: food, school supplies, miscellaneous toiletries. They can use absolutely everything. So if you could see it in your heart to put something together, and I know there's very specific instructions on how you drop it off at their back door, and you would just let them know it's there. They pick it up and they would clean it off and then disperse it as they need it. So please do think of doing that. We also have said too, last week we said that when the big brothers and big sisters gets rolling, what we wanted to do is, you know, in support of the community of our businesses, our small local businesses that really could use your support, we have said that, you know, buy gift cards, movie passes, restaurant gift cards, you name it, and keep them so that when things start to roll again, you can take your little brother, little sister, or those big brothers and big sisters can take their little brother and little sister and do something fun, because I'm sure they've been going through some trying times as well. So I have a tip, Matt. We have a question. Okay, I have a tip, Matt, just so you know, for all of us that are looking at our computers pretty much all day and probably beyond the day, there is a simple eye exercise that you should be doing. I would like to start to practice it. So for 10 to 15 seconds, you should take your eyes off the computer and look far away. And do that for 10 to 15 seconds. Then go back to your computer, look at the computer for 10 to 15 seconds. Then look away far for 10 to 15 seconds. Do that 10 times. They say it's really important to be exercising your eye because a lot of us are spending maybe too much time in front of our computers. So this be a good thing to do for the health of your eye. So there's my update for the day. So quick tips, and then we're going to introduce Matt. I do want to just throw it out there that a lot of our questions now, remember we've gone through our 4 sessions and we've talked about these waves. Now, one of the big waves that we're starting to see is as the government's starting to phase in. I know they've pulled back a little bit because of the Laloche incident, which is unfortunate. So then we've got a lot of calls that are coming in, and they're talking about temporary layoffs, which we know we've been doing a lot of that. But now we're seeing some of that moving into permanent layoffs. And it's for a combination of reasons. We're finding that with the permanent layoffs, I know there is some businesses that are able to bring employees back to work. Maybe it's a hotel that wants to go through some deep cleaning to prepare for when they do open their doors. So there's those kind of situations where there is that ability to still bring some people back to work. But I know that there is a conversation going on that they're there is not a fear. They don't want to come back to work. So what is it that you would do with these employees that refuse to come back to work? So I know that in talking to, and we'll introduce a couple speakers that we're going to be having in 2 sessions from now. But they do say that there is certainly some parameters that you have to work within. You can ask them to come back to work as long as you've done everything that you need to be doing in order to keep that environment safe for that employee. If they have compromised health or are with people with compromised health, it may be a situation where they can't come back because there is fear of obviously getting ill or passing it on. But if they just don't want to come back, I mean, you certainly are, as an employer, within your right to consider a permanent layoff. And then with that comes the benefit conversation, because benefits do stop when you go to a permanent layoff. And you want to make sure that's clear and you have that communicated to the employee. So we have in 2 weeks, we've got 2 lawyers, Stephen Nicholson and Adam Touet from the W Law Group, and we're going to have some interesting discussion what they're seeing at their end. And what's really nice is Stephen has got a fairly good depth as it relates to the government benefits, and so he's going to talk a little bit about what he's seeing with the government benefits and some of the gray areas that they're having to address with the employers. So Adam is an expert in the employment law side, so it will be interesting to debate some of the things that we're going to see in 2 weeks with them. Next week, I'm really excited. We've got Alex Fallon of Sreda coming to visit with us from abroad. And we're going to just talk about the landscape of what's happening out there. Yes, we've got these phases coming in. This is really exciting. We're also seeing bumps. We're seeing resistance. We're seeing, you know, some additional stressors from it. What does this look like? And what is the business community saying to it? So I think it'll be really quite interesting to talk to Alex and then find out, you know, from his perspective, what he's seeing, me obviously being in amongst the private sector out there. So I think we're good. All righty. Okay, Matt, we're going to bring you on. So Matt from Wello, Matt Brady. One thing that I do know about Matt, and we've had a few opportunities to talk, because obviously we've spent the last few weeks getting our platform ready on our website to do voluntary virtual healthcare. So that's how Matt and I had met with Wello. So welcome, Matt. And thank you for coming. Thank you for coming on to talk with us. So he's very passionate about health. He's very, very well educated, certainly spends a lot of time in this space. He works with clients and he educates them, and he shares his knowledge to the business as well, the clients and employees within Canada. And his job is to build the relationships and to really be there to help people understand where the opportunities are, to walk them through the maze of getting this movement. And I think, and we'll talk about it, I think that this is something that's really grown a lot, and it's here to stay. Oh, we're going to go this way. All right. We're having all sorts of issues today, Matt. And no, there's no alcohol in this cup yet. Honest, there's not. Maybe later. Maybe later.
It's 1 p.m. where I am, so maybe it's okay to open a drink.
I'll borrow anybody's 5 o'clock cocktail time. So Wello is a virtual healthcare company and provides employees with direct and friendly access to healthcare and wellness through chat and video anywhere in Canada. So that's what I like about it, because I have clients that are from one end of the provinces to the other end of the provinces. They're a team of in-house clinicians. They help employees skip the queue and really get the access they need on a timely fashion and a safe fashion, especially today with COVID. So we're really excited to be working with Wello's as Wiegers Financial to have them on board as a virtual care provider. And I'd like to just maybe throw this out. Matt, how are you doing out there? Tell everybody where you're from.
Yeah, so I'm from Toronto. I was actually born out in Calgary, moved to Toronto when I was young, and working in Toronto now. So I was a member of the Wello. I was the first member of the Wello team in Toronto. So they expanded out east. I think it was mid 2018 when I joined the team, and so it's almost been 2 years, and we've really built up quite a team in Toronto as well. So our headquarters is still in Calgary. Our nurse practitioners and physicians are working remote across Canada, not because of COVID-19. They always work remote, so they're scattered in different provinces. But yeah, in Toronto, it's been raining here for the last couple of days, and yeah, it's getting old quick, I should say.
I wouldn't. Yeah. You know what? The one thing that I'm very grateful for is our weather's been fantastic out here. So other than a little bit of wind, we've been able to, get outside and get a little bit of fresh air. I went walking last night and I couldn't believe how many birds were in trees at 8 o'clock at night. It was just like, I don't know. I obviously never paid attention before, but I heard a lot of birds in trees last night. So it was really nice. Actually, it was nice. So you guys are probably, obviously you guys have got more, I wouldn't want to say challenges. I know that we've been very, very good at a province in terms of managing the COVID. And I know you guys have had some spikes in areas. So is it the tension levels, is the stress levels a little bit more higher in your world?
Yeah, I think what's interesting now is I think it was just on Monday, our highest day for cases in Ontario was on Monday. We had 525 new cases in one day, which was the highest yet. I think that's super frustrating for Ontarians because we think we're almost at the light of the end of the tunnel here. Certain provinces in Canada, like BC, is talking about reopening, whereas Ontario, we're getting worse, and it's frustrating. We've been inside for 6 or 8 weeks now. We've been quarantined, self-isolating, physical distancing, and I think people are getting tired of it. So yeah, I think people are frustrated.
Yeah. Well, I'll echo that, and I feel for you because we haven't been held captive quite as long as you guys, and for us, I think we're feeling a little bit more comfort, although we're still getting new cases. But I know certainly captivity is not working well for some of us, and so it's what we hope is the phases. They had to pull back a little bit from what I've heard, but what we're going to really hope is that we can move forward and resume some type of normal. We're not sure what that looks like, when it's going to happen, but I think you're going to see virtual care obviously really come into play, and especially when it comes to the psychiatric or the psychology side of things. I think that, the EAP, and the cognitive health behavior, all these things that we've been talking about, it couldn't be needed more than ever right now. So thanks for that. So what is, if we looked at the broader picture, what is virtual care? Like, how would you explain it to people? Someone said, I read an article about virtual care.
Yeah, it's quite plain and simple, I would say. It's basically a means of connecting with a medical professional over video, phone, or chat. That can be through your mobile device or your laptop, desktop, computer. For something, you can maybe think twice now and say, could I do this virtually? Do I have to go to the clinic? And that's really how I like to think of virtual care, plain and simple.
Yeah. No, and the good news is that I think it's being utilized a lot. Now, when I think of virtual care, and I think maybe to the audience, because we call it virtual care, virtual telehealth, I also look at the virtual care space, especially in benefits, because that's my space, is when we're looking at paramedicals. So we're looking at the physiotherapy, the things that keep us well, that we have to still have access to. So how do we do that? And I know that that's where there's been a really big push with a lot of these practitioners to work in that space to try and create applications that allow for health to be done mobile, by video, that type of stuff. I even actually saw an article from a massage, speaking from the voice of a massage therapist, and they're actually trying to work around what are the things that they can do to still provide some level of care through an app. And I know it's not the same, but anything's better than nothing, right?
Yeah, definitely. And just an interesting stat for you, Deb, I think it was 1978, the first virtual appointment ever took place, and it was just over a telephone, which is, it's funny to me because, here we are 40 years later or whatever it is, and our main source at Wello of interactions is still through the phone. It's not over video, which is really interesting to me.
Yeah. And you know what? It was funny because I was doing a little bit of reading too, and they said like that was about 30 years back, well, more than, right? And you think, wow, so this isn't new. It's not new. We just haven't moved into the space. So why hadn't we moved into the space? It was out there a while back. So why hadn't we moved into the space?
Yeah, I think a couple factors. For one, in Canada, we're very lucky to have free healthcare. And previously, governments outside of the province of BC did not provide virtual healthcare for free to consumers. So you had to pay for it privately. And why would you do that if you can get virtual services?
What, Matt?
Yep.
I'm gonna have to just cut you short. Can the audience can't see you or can't hear you?
You can't hear me, Deb?
I can hear you. Can they see me, Colt?
Yep.
All right.
Let me just
so we lost Matt for a moment.
We just lost Matt for a moment. He's gonna reboot.
Why don't you reiterate what he just
told
you?
Yeah, so we talked about why telehealth has been around for a long time, over 30 years. And I know I read an interesting stat where they said today, so if we've been doing this and thinking and working in this space for 30 years, today, interestingly enough, 0.15 of healthcare visits in Canada are done virtually, like a very small amount. So, I'd asked Matt, I said, like, why is it that it hasn't? And I think part of it has been a little bit of the challenge in the technology to move into the space. And I know that, that for us, obviously with today, there's a lot of things to be thinking about. The other thing that I believe is that it's kind of the mindset. I know when we started working with virtual care, even a few years back, it was really hard to comprehend the idea that you would be on the phone with a doctor rather not in their office. So I know that there was a lot of hesitation, call it that, as to whether or not this made any sense at all. And there was, certainly some myths that people had with respect to, the whole idea of doing anything virtual. So move that forward, and here we are. So it's interesting that we've had to move and forward and do the things we need to do in the COVID world. So we are finding out that there is a huge interest. So one of the things that I came across was a stat about the younger generation, and they asked the question about whether or not you'd want to see telecare in your world. 78% of the younger Canadian generation said they would be really happy to see this in their world. So that's huge. 78% of the people out there, they really realize that there's some benefits to it, and there's benefits on both sides of it. There's benefits from the employer's perspective, and there's certainly benefits from the employee's perspective. So the thing that challenges us right now is that when we talk about it's been around, we're not really using it as much as we could be. It's moving quickly, but it has to move even quicker. About 9% of the employers are really embracing it and moving into this space. Now the suppliers out there are really having a lot of virtual of everything. They're doing virtual enrollment, they're doing virtual care as it relates to the benefits. So there is going to be, I think, more movement now on that level, and I think that would be really good to see. We certainly see that the demand is there on the paramedicals, as we now know, and for the reasons of. So that was one thing I thought was really interesting stat. How are we doing? Have we got Matt back?
I think so.
Matt, are you back?
We'll have to wait for the audience to let us know here.
We're going to just wait one more minute. So, Matt.
They might be able to hear him.
Okay, no worries.
This is a new one. They could hear him, but they couldn't see him.
Okay, no worries. But the good thing is you're listening to me, Matt. So if you have anything that you need to jump in and say, you can let me know. So
you could just keep going for a little bit.
Okay. Yeah. Okay. I'm going to relay what Matt just told me. He said that virtual healthcare was really about 12 years ago in the States is when they started to see much more movement. And I know with the the psychologist side of things, cognitive behavior therapy was another well talked about item, but there was resistance because it was a face-to-face that made most sense. And I understand, in the world of sales, we say that too. Face-to-face is the best that you can have. But based on the inability for people to connect in person, maybe it was just demographically you couldn't make it happen. Maybe there needed to be more regular visits. There was a cost impact to it. that's where you started to see the therapy start to move into the cognitive space and do it virtually. And from what we hear is that there is certainly some benefits in having that, especially now. There's that regular touch and that regular exercise of really working on your mental well-being. So if we look at virtual care, the question would be in terms of providers and platforms. I mean, there's many out there now. There used to be one or two. Now there's many that are in this space. And so some of the things that would be, I guess, important when you're looking at virtual care is to, not that you have to be the specialist and understand it, but I think to really, for me, what was really important is to really know what is the capacity for them to care. Especially when we're looking at virtual telemedicine, do they have the medical support to be there and provide the care? I know the government has done a good job by bringing in Lumica, and we talked about this a few sessions back. I know the insurance companies are moving their platforms forward a bit more, and the one thing that we do need to be careful for, there's others that are out there, is do they have the capacity to make sure that when someone does make a call in, they can get a response in a fairly efficient and short time frame. So that would be one thing. 24 hours might be another concern because everybody's on different clocks. It would be interesting, to know and ask those questions when you're working and researching these things. Do they have the ability to do face-to-face interaction? I think that's still important by video. Telephone calls are great, but when you're doing virtual telemedicine, I know Matt would agree, I mean, there's some things that they need to delve into that do require face-to-face conversation as well. So, when you're looking at care, if you're not feeling well, if you've got a rash, if you've got, something that you need to be showing and sharing a conversation, you need to have that ability to be obviously video-based. Bilingual, because we have a lot of movement in spaces across the world with people that are now saying, well, I mean, great that we've got English, but we need to have access to other languages if we're going to do this. My workplace is such that I've got 3 or 4 different languages. So will this work for us? So I know Matt Wello is certainly a broad base and across Canada. And I know in reading that Wello has got bilingual access for the care of your employees as well. The expertise is really important. You just you have to know that you're dealing with an expert, and so the clinicians have to be at the level of care that they can help. And again, I know that Wello when our research was done, Wello was certainly had the background of the experts that were there for us, and that could give it back to us in a timely fashion. So a bonus to that. We talk a little bit about, the security and the platforms. And I know this isn't every level, as I've seen in insurance companies. When we look at, is this a secure line? Can I be talking to you? Can I be face-to-face on the phone? I know that I've got the privacy. And absolutely, there is the security levels have been hit on every level. And when we do get Matt back, I'm going to have him maybe talk a little bit about that. We actually maybe we'll have him back. So we do have Matt back. I think we've got Matt back.
Can you guys hear me?
I can hear you now. Can you hear Colt? Yeah, I think the audience can hear, is what you're telling me?
I think so.
Okay. So I was just going through, some of the things to be thinking about when you're looking for virtual healthcare as you were listening. So you might want to finish off, add in a couple of quick points what you need to be telling the audience to be looking for if you're looking for a virtual provider.
Yeah, so I mean, there's a number of things to be looking for. And I think I was saying this to the other day, Deb, it's really a matter of you pay for what you get. So it's like buying a car. You can buy, if you take a car for free, it's probably not going to be that good. But if you put the money in, it's going to be a great service. So there are lots of free options out there in Canada. So Lumica Health has come out in Saskatchewan. There's different providers within each province. And the important distinction there is that the provincial telemedicine provider can only offer it for free to the consumers. It can't be a B2B transaction. So Lumica Health, for example, is only allowed to deal with the province of Saskatchewan consumers. Yes. And the doctors are billing it for free. So there's a lot of public service options out there. What you're going to see right now is with the volume of calls, there's going to be a delay in waiting times with a lot of those service providers. There have been some provincial service providers that are using chatbots and AI as a way to kind of screen everyone before they actually get an appointment with a physician to handle some of those loads. And I'm not saying these are good or bad, I'm just telling you kind of the facts on what you're going to get. And then in Canada, we also have a number of private providers, which Wello would fall under the umbrella of those. And a lot of us have been around since 2017, 2016. And the private providers are usually incorporated into an employee benefits plan. So there's Wello, there's Maple, Dialogue, Akira, EQ Care. There's a number, I think there's about 5 or 6 of us large providers in Canada. And really those are usually paid for by the employer. And what you're going to see with those companies is a lot faster service than the public system. And that's what you've seen for years. It's not just virtual healthcare. You're seeing that distinction between private and public. But you know, private clinics have been around for a long time, and it's no secret that it's a lot faster service than a public clinic. So that's kind of the distinction there. Did you have any thoughts on your end, Deb?
No, and I'll agree, because I know at the end of the day, I mean, we want the support systems to be there on all levels, but we also know that we're going to hit bottlenecks. I call it that. So, I mean, it was great that there was some offerings that came forward, you know, fairly quickly, as you referenced to Lumicon we've done before. But I think the need has increased a whole lot since even that conversation. So I think we really start to look at what are the other vehicles that are out there. I'm really excited, and I want to say thank you to Wello, is that they provided, is it 30 days where you're providing virtual care services, and then we've got the pricing model going forward, right? Correct, Matt? I know it just came
exactly. Up. Yeah. So for your clients at Wiegers, what we've done is we'll give you a 30-day free trial for your employees to test out the service, and then thereafter you'll be able to implement Wello at a very discounted rate. So
thank you.
I think it's at around employee per month after the 30-day trial. So we also have our consumer set up on your website, which is great as well.
Yes, no, and thank you for that, because I know that one of our providers had done that as well. And I mean, for us, the disappointment is that although the insurers out there are doing some of these things, they're not doing them all the same, and we're at very different levels. So for Wiegers and our clients, at least we have that opportunity for them to get the care when they need it. And then to even just have the access to, you know, like you said, the pricing model going forward. So thank you for that. So there's myths. You know, we talk a lot about, you know, this, you know, because it's like the banking, you know, people wouldn't do online banking because they were very scared of what was going to be, you know, happening in terms of people snatching their, you know, their bank accounts. There are some myths that come along with this because we're talking sensitive stuff here. We're talking our health. We're talking, you know, our mental well-being. And so people are very cautious. So I know I did a little bit of kind of searching, and I'm going to say one and then you say one. How's that go, Matt? So yeah, here was myth. Yeah.
Sounds good to me.
So myth number 1 was virtual care professionals can't treat patients effectively. And we talked about that right in the screen. So you tell me, why would people think that? Like, I mean, and why would it not be that?
Yeah, so I mean, I think people have a misconception, and I know in Ontario here we put out a service called telehealth about 10 years ago or something like that, and basically with that service, it's a registered nurse on the other end. So registered nurses cannot diagnose, treat, or prescribe the same way a nurse practitioner or a doctor can. So I think the government of Ontario put out telehealth a long time ago as a way to hopefully relieve the public system. But unfortunately, it's just not able to do what people actually need for their medical care. So prescription, lab requisitions, and things like that. And I think, you know, that has led people to believe that telehealth cannot help you, whereas it definitely can. Our medical director estimates about 70% of cases can be solved virtually. Wow. So don't quote me on that, but I think that is correct. It's definitely within the ballpark there, 65 to 75%, somewhere in there. And so with that number, you got to think that you can use Wello or another virtual provider for most things. And then on top of that, we run a survey on Wello asking, did we resolve your issue today? And 95% of the time, survey respondents come back saying yes. So in practice, it's actually a lot higher than 70%, which is great to see.
That's perfect. No, I appreciate that. Now and there's a lot of myths, but I'm going to throw out one that I thought was interesting. Is one of them says, "Oh, you guys are just going to be thrown out." Like, and I'm thinking from the employer's perspective. If we do this, the employees call, and you're going to be able to throw out sick notes left, right, and center. So this is going to make this more difficult for me. And I think we've lost him again.
I'm here.
Are you? I got you on the phone. I'm just thinking if we got you on the screen. Wow, this has just been quite a party.
Tell me about it. If anyone's in the chat, if they could let us know if they can hear me, that'd be awesome.
Can you see that, Colt? If someone can answer if they can hear.
Oh, I hear. Yeah.
You can hear? Okay.
We'll just keep them on audio.
Okay. Yeah. Okay. They can't see you, but they can hear you. Correct, Matt or Colt? Okay. That's perfect. Okay, we'll go with it. So we talked about the sick notes, and they said, like, you know, when they talked about, and then I'll throw this all together. They said, oh, you're going to be able to like hand out lots of antibiotics, and oh my gosh, you're going to start to be drug pushers, you know, giving out, high level medication. Is that true?
No, definitely not. The nurse practitioners and physicians carry the same duty of care that they would in a physical clinic. They're never just going to throw prescriptions at you. They would be at risk of losing their license personally, as well as being faced with some high legal implications for that. So they all have a duty of care within their college that they respond to, and it's very clearly laid out within the different provinces of college of nurses and or college of physicians and yeah, so they're always going to follow that duty of care. And when it comes to medical notes, it's the same thing. We're not going to just be throwing out medical notes. Again, it's within the duty of care. If they're not fit for work, we'll be honest about that. And to be honest, Deb, I think a lot of people could go to a physical clinic in today's world and make the same assumptions. So regardless of whether it's virtual or in a physical clinic, I think there are those options if an individual is seeking something to take advantage of a healthcare professional or something like that. So
yeah, I agree 100%, because it doesn't matter what profession. There's always going to be the greater majority of the people are doing it all right and have a conscience, and there's some that just aren't going to. So you know what, it doesn't matter whether it's virtual or in your doctor's office. I think we still run the same risk. So I will absolutely echo that. The other thing that because I did a lousy job, I'm not gonna lie, Matt, I did a lousy job. So the myth is that virtual care is not secure. I think you give it a more professional spin on, is it or is it not?
Yeah, so is it secure? Yes. Sorry, I'm pausing here, Deb, because it depends what platform you're talking about, to be honest. I can speak on Wello's behalf. We are very secure. We've been delivering medical care for 40 years. So when it comes to privacy and security, it's not something that's new to us. There's other platforms out there that have been shown to not be as secure as, or not adhere to the same standards that we do. So it really depends. It's a provider to provider question. I hope that all the virtual providers out there are doing their due diligence and adhering to HIPAA regulations and the Canadian Health Act. But unfortunately, there's some providers out there where that's not the case.
No, and I agree. And we referenced that just a couple of questions back. That's why it's really, really important. If you're going into this space, you need to have do the due diligence and do the research on the carrier or provider that you're looking at, and ask those questions. Where is the security level for you and for your employees, right? So, we talked about a little bit of this, but I found it interesting is that like the government, I know that the government is doing a little bit of that right now. Are they doing enough? Do you think they're going to do more? Should they be doing more?
Yeah, they have to do more. They really do have to do more. And it's unfortunate with the, telemedicine coming on so fast. I think everybody really jumped on the virtual healthcare telemedicine train very quickly during the COVID-19 outbreak. And unfortunately, there just wasn't enough time for everybody to take the to take the proper steps, checking privacy and security and things like that. So it's, you know, it's like when anything happens too fast, these things get missed. So and it's unfortunate because, you know, virtual healthcare is a very great tool. And we really had a chance as an industry to make a really good impression. And I think we have with a lot of companies and things like that. But on the consumer side, it hasn't been as promising as I think it was set out to be.
Yeah, I think it's, you know, more again, I mean, it's something along the lines that sometimes the new things become the most resistant opportunities. Like people are just, you know, and you get the naysayers, right? And I know some of the challenging things that, you know, like you think about even, you know, with cannabis, medical cannabis, and maybe that's not, but there is space for medical cannabis. But when you talk about, you know, the consumer and who do you need to get the buy-in from? I mean, I know that we see a lot of, you know, resistance in that space, and yet the studies are being done that there is definitely a need for it. So with virtual healthcare, I think, you know, when we look at province to province, I know for my clients, I know they've got a lot of Saskatchewan-based clients, but I also have clients that are, you know, in other provinces. So if the governments aren't coming together and having this streamlined conversation, a little bit like with COVID, I guess phases and their perception and who's doing what first and when, it's going to falter, and it's going to come back looking bad on the provider that's trying to do the right thing, right? So I know that the Medical Association, the Canadian Medical Association, they've got a task force going, and I found that interesting because I didn't know that. It's a virtual care task force. So they're really trying to deep dive into some of these things to say, you know what, we have to do this and do it now and do it well, because we've been dancing all over this for many years, and now we need to do it well, and we need to do it now. So we'll see what that means as we go through the motions of the post-COVID, because that's really where you're going to see the uptake. I mean, that is going to have to be, if it's not done well now, the uptake on it's going to be slow. Would you not agree?
Yeah, I do agree. And yeah, you know, it is similar with your analogy to the banking, online banking. I mean, when that came out, nobody trusted it either. I remember, and not to date my mom's age or anything, but I just remember her not, you know, putting credit card info into a website because she didn't trust it. And it's the exact same thing that's happening now with virtual healthcare. I think in 10 years we'll look back and remember, oh yeah, or, you know, how come we didn't trust that, right? And so I think, you know, it's just an evolution of a new technology that's really good for us in the long run.
Yeah, I agree. So I won't. This wasn't me. This would be my mother. I remember when the ATM came out, and I remember the resistance on the ATM, and now that's old. Yeah. Right. Yeah. And it wasn't that long ago, actually, but I just remember thinking that people, why would I go to this machine? It's going to take my information, and where's it going to take it? Right. Yeah. And now you look back and you laugh and you're going, wow. Like, yeah. So no, I agree. Like, I mean, one of the kind of the surveys that were done, they talked about, you know, like what are people, where are people's headspace? And although there's a very a small amount on that, like a huge interest to get going, doing this thing. The good news is 60% are saying, not quite sure, but I believe that it's the right thing to do. So I'm coming in with my eyes open, and I'll listen. And hopefully what you guys are doing out there on the provider side is that you're just providing the trust when you're educating the client, and then if you build the trust, even though some people might feel a little bit uncertain about it, and that goes right down to the employees, right? It's not just the employer that you're talking to, it's just building that trust with them, so that once they try this once they try it twice, they're hooked. It just would make sense, right? And I know from employers' perspective, you know, there is a little bit of skepticism, but they understand the opportunities. Because when we're looking and we talk about, like, specifically Wello and the telemedicine model that you and I are working with, the one thing that they're saying, like, I mean, absenteeism, right? You know, like I go, like, if I have to, you know, have my employees leave at 2 o'clock to go sit in a merge to get in 2 hours later, who is it helping? Is it really good use? I mean, I need this employee at work. So there is definite employer opportunities or advantages when you're getting into this space. And I mean, that was one. You throw out another one or two that you think are really good opportunities for employers to really be thinking about this.
Yeah, and further to that, Deb, the average person living with a chronic condition goes to the doctor 13 times per year. So when you think about that from an absenteeism perspective, it's really in the chronic conditions that you're seeing the high absenteeism rates. So if you can have a virtual appointment for those employees, then there's a huge ROI there. So and then I would just say it's another great service to offer to your employees that's consistent across Canada. So if you have employees in remote areas or different provinces, different cities, or things like that, it really is a great service to offer to your employees where everyone can access it. They're going to use it. The utilization is very high with virtual healthcare, much higher than an EAP program, because everybody gets sick. And it's just a matter of fact that everyone gets sick, a family member gets sick or anything like that. So the utilization is high, and I think that really supports the bang for your buck value.
Yeah, I agree. I know for me personally, I mean, the fact that if I wasn't feeling well, or maybe I didn't, just had to do a regular checkup or whatever, I get anxious going into the doctor's office now because I don't know if I'm going to come out healthy. And I know that stresses a lot of people. Can you imagine now, like with COVID? I think there's just going to be, that's why I look at these phases, and I still think there's going to be a lot of resistance for people to move out into the public space. And I understand that, right?
Yeah, it's not going to change just because there's a vaccine or whatever. I think this whole COVID thing is going to turn us all into germaphobes, and we're going to think twice about going to public places. I really do. I think that's going to be the new normal for at least the next 3 or 4 years. So.
Well, and it goes back to what we've said in the last few sessions, and we'll continue to talk about it. Like in our and Matt, I mean, we work hard to have preferred partners in place, and one of the things that we always say, well-being, physically, mentally, spiritually. There's all those levels that you have to take care of your health. You have to. Yeah. And I think of course we're all agreeing that our mental capacity is being challenged at the utmost levels right now. And I guess maybe the good of this is that we're all feeling it, so we're not alone. I mean, I think that's really, really important. But that's where the virtual care model still is going to be that place or that space that people can go to. But our health is going to be really indicative in terms of how we're going to be able to move forward in this new normal. And I can't stress enough how important your health, your own well-being and your health is going to be to get through these next phases of post-COVID. So, but
yeah, exactly. And I mean, I read an interesting stat this morning that says 90% of COVID deaths are related to predisposed conditions. So, if there's one thing I can say is, do everything you can in your power to not find yourself in a trap in 20 years with one of those predisposed conditions, because we don't know what's coming. So you got to look after your health now, and you'll be healthy later. So
yeah. And then on that note, and then I'll close it out, because that's again on the wellness side, they're moving into this virtual space too. You can stay healthy and do it virtually. You just need to be disciplined, and you've got to understand why does you need to be doing what you're doing. So I agree with that. Well, Matt, I have to tell you, this has been an interesting interview. We're going to probably, you were on, you were off, you were on, you were off, but you know what? I think we pulled it off. I think we covered all the points that I wanted to cover. And I want to thank you for that. I mean, I'm looking forward to working with Wello. Thank you very much for providing that complimentary service to our clients. I think that's really going to be important. I welcome the audience on any level. If there's any questions on telemedicine, telecare, to forward it to me. If it's questions that I need to have Matt, answer back, we can absolutely get that for you. So I do want to say thank you for joining in, and the patients. And Matt, thank you very much for joining us. You know what? We're going to connect again, and this time maybe they'll get to see your face.
Yeah, exactly. And
they did for a while, maybe. I don't know.
Yeah, maybe we could turn this into a podcast or something. So, because clearly the video didn't work. So,
you know what? Not a bad idea. There you go, Colt. We always say in our world, if we're going to do one thing, we got to be able to do it in 4 different ways. So
yep,
there you go.
Exactly. Thank you so much, Deb. Really appreciate you having me on today, and happy to connect with any of your clients there if they have any questions. So thank you very much.
Well, thank you, Matt. And Matt, I'm telling the audience too, I mean, obviously this is a taped program. It's not quite the same, but it's still going to have the same content. So it will be posted to our Facebook and our website. So it'll be available to you to watch for those who weren't able to capture all of it. I do want to, and I know, Matt, I've asked you, and I'll want to see you joining our private Facebook. We have a best practices FAQ. Private Facebook, and we've been getting some really good uptake. We're sharing a lot of the things that we're talking on these, live sessions, the readings I'm doing, the conversations I'm having. We're really getting into this peer-to-peer space, people being able to ask those tough questions in a safe environment and be able to post when they find. We're excited to get, some legal professional support in there. We've got HR support in there. Certainly a lot of businesses, HR of companies in there. So it's a really, really good spot to really, tackle, tough questions that you maybe don't want to be asking in a face-to-face or online. So thank you for coming on board, everybody. Please do check out our Facebook. Next week, Alex Fallon from Srida. We're going to do like that business to business banter. What's he seeing out there? What are the challenges businesses are having? And I really think it's going to be an interesting dialogue. So I'm really looking forward to, as Alex would say, Colton, he says, let's do this and crush it. So I know we will. And then 2 weeks from now, we're going to have our lawyers join us talking about some of the challenges we're seeing in the space of the employment subsidies, the government subsidies, those types of things. There are grays in there, what they're having to coach their clients through, and certainly talking to some of the legal ramifications that are coming from probably not making the best move. We've cautioned you always that we talk about make sure that you get legal counsel, make sure that you document, make sure you follow a process. If you don't have a process, put a process in place. And get the support from the professionals you need before you make some of these movements, so that when everything settles, you're not going to wish you had. So I want to say thank you, everybody. Anything else we want to add, Colton, that I may have missed? We're good. So thank you for joining in. Colton's been on the side trying to do the video thing, and have an awesome day. Sign language. No, he's not doing sign language. Oh, Colton needs absolutely. I'm going to do the shameless plug for him. Colton's running for the board of directors for the chamber. So you need to go get your vote in. And I'm going to tell you, and not because he's my son, but you won't have a better fellow on the board. So go vote and vote for Colton.
Yeah, not a biased plug at all.
Not a biased plug. I would have said it anyway.
Yeah,
and yeah, absolutely. He's been experienced in the world of business long enough to know that there's some opportunities for him to certainly do some great things. So thank you, everybody, for joining in. Thank you, Matt, again, for being our guest. Have a wonderful day. Stay healthy, stay well, stay and remain optimistic. Thank you. Take care.